Good afternoon.
Good afternoon, everyone. Oh, it's great to see so many great faces. As
We have
people
folks.
come in, I gotta admit all here.
I can do this too, Lisa.
Can you, oh, that's true.
Mhm.
Or we can see, I'm getting better and better with technology, everyone.
What's
I
funny
have
is we could
a
go
note
back.
taker. I
We
have a
could,
note taker now. I
you
didn't even know I
do?
had a note taker. Oh my goodness. Well, I have a note taker. I'm wondering how we can, oh no, wait. Trying to figure out how we can just admit everyone.
Working on it.
Oh, I know. What would I do without Leah?
The same things that I'm doing.
Welcome, everyone. As Leah works on the waiting room to the St. Louis Region Childhood Community Leader Monthly Task Force meeting. We're so excited to have everyone here on a beautiful, beautiful April spring afternoon in St. Louis. Our guests are speakers that are all in Columbia, Missouri, with Parent Link, and very much looking forward to learning all of their great resources on this meeting. We will let others continue to join us. I see in the, oh, people keep coming in. As we let more and more people in, and we'll start here in a minute or two, I'm so excited. I hope everyone has heard about the 2025 Early Educators Appreciation Event here in St. Louis. We're working hard. 160 individual, or I should say 92 individuals, 160 nominations of early childhood educators were nominated. Who have dedicated their lives to serving young children, low-income children, and families. And I am so proud. This event's on May 4th at the new Clark Family Branch at the St. Louis County Library, and it is going to be a grand event. So there's only a few tickets left. Capacity is 300. So I think this year it's time to celebrate. It's time to take a deep breath and
Yeah.
and celebrate all those who take care of our kids every
Oh,
day.
no, there I am. Okay. I'm on mute and
I'm looking at Zoom and it's all AI stuff.
Lisa,
All
I'll go
right,
ahead and hopefully
please
you
do.
all are seeing our sweet little baby on the screen. I'm going to
This
try
is our
to.
childhood community leader, child from Baden Christian Child Care Center. Did you know that, Leah?
I did, but what I don't know is how old little kiddo is now. Do we
Yeah,
know
I
that?
understand from Lisa Shear, he might be in college at this point. Um, so, so, but you know that you're in the right meeting when you see him. All right. I think we should go ahead and do introductions. My name is Lisa Greening. I'm the Executive Director of Turn the Page STL. We are St. Louis's chapter of the Campaign for Grade Level Reading. And this early learning work is essential for our children to be able to read proficiently because 90% of language happens before age 5. So thank you all for all of your work. My colleague here is Leah Moser here with UMSL's Community Innovation and Action Center. Would you like to say anything, Leah?
Hi. good to be here with you all today. I am the Planning and Operations Lead at the Community Innovation Action Center. Have done some statewide early childhood work. My projects now have shifted a little bit. So we are a center at the university that is issue agnostic. So we sometimes have early childhood projects, and sometimes our work takes us to projects related to housing and violence prevention and data infrastructure. So we do a whole lot of things here at SEAC. And then our other colleague, who I don't know if she has slipped into our
Not
meeting.
able to join us.
Okay, Tiffany Herbert with the City of St. Charles School District is our third community leader, helping to represent the St. Charles area of our region. So that's a little bit about who we are. Today we have an exciting agenda planned for you all. We will start our meeting as we usually do with some introductions, and we will have a prompt for you, a brief prompt. If you are able and would enjoy coming off of mute to give your introduction, we'd very much like that, so we get to know you all a little bit better. If it's easier for you to do your introduction in the chat, that is perfectly fine too. We have with us today folks joining us from Columbia. You'll see their Mizzou columns in the back. Rachel Manning, Angie Nickel, and Kelsey Cunningham from ParentLink are going to come and share a little bit more about what ParentLink does and the services and resources that are available. We will do a quick review of our vision and goals for our community leader work across the state of Missouri and here in St. Louis, talk a little bit about some upcoming transition. Lisa's going to share some information about the Childhood Community Leader Survey, and we hope to have some time in this meeting for you to actually be able to complete that survey. It takes a couple of minutes and give some feedback on your experience with the community leader work. You can comment on Lisa and I if you feel so compelled. Positive things only. Just kidding. But your reflections on this work in the region and what you hope to see. We have some resources that we would like to share with you, and then we'll talk about our schedule and speaker next month. And I see we've got some more folks coming into the room. So I'm going to turn it over to Lisa to questions for us.
And I'm going to put in the chat, we're going to ask everybody one at a time. We'll take the PowerPoint down here in a second. We're going to ask everybody if you could just tell us your name, your organization, and we're really curious. And you're welcome if you want to keep thinking about this and sending this to us. But what are the resources and or supports that your families request the most? We'll put that in the chat, but Leah, do you want to take the, so we can see everybody's great faces? Take the PowerPoint down? Oh, I can't see a lot of faces. Come on, guys. I bet everybody's just sitting outside in their lawn chair right now, sipping on their drink.
I saw Jamie earlier. It looked like, yeah, you were outside.
All right, Jamie. Jamie, introduce yourself.
Hi, everyone. I am very lucky today to be able to spend a little time working from home. I am the statewide manager of, I'm the senior manager of statewide initiatives at United for Children. I do a lot of behind the scenes support for the community leader work alongside Stacy Sarton, but I am here in St. Louis, and I'm excited to be a part of the stakeholders group. So one of the things I was thinking about as you were talking about requested resources through United for Children, we do currently have the resource and referral call center through DESE Office of Childhood. And we do have a lot of requests around needs around childcare, supporting childcare providers. But what I'm really excited about, we've been working on a lot, is supporting new mothers and parents with pack and plays and cribs. And so we have been distributing pack and plays and cribs to new families and parents in the St. Louis City and St. Louis County areas. So I will try and get more information on that program so you can share as well with families in that footprint. And I am going to go on and off
It is
camera, so
amazing.
I'm
I
not
didn't know
making
that.
it too obvious that I am sitting outside at this
I,
moment.
we love it. We love it. And I feel like with United for Children, my office is on the same floor, and I did not know that you guys offered that service. So that is fantastic. It's a lot of basic services. I'm just looking in the chat here, you know, for diapers and
Yes.
car seats, and you know, it starts with those basic needs. So I appreciate people sharing. Would anybody else like to come off bravely?
I'll jump in since Jamie just introduced us. I'll go with the
Yay,
United for
Becky.
Children bandwagon. I'm Becky
Mhm.
Strickfadden, and I am the inclusion manager at United for Children. I am based out of St. Louis, but we cover the entire state. So right now, because of where we have staffing, that I traveling a lot of the state of Missouri. I think the biggest thing that we get requests is just like access to things. And so, you know, not necessarily only in St. Louis, but especially in the more rural areas or the areas that are a little bit further out, either having access to services or not having long wait lists for services. So I know like some of the programs that offer amazing services, but there is, you know, a year-long wait to get in. And so being able to help kind of get more get people resources within a time frame that makes sense to them and that gives them the support in the meantime. So I think that's probably the biggest thing that I hear is just, oh well, I'm on their waiting list, but they said it's a you know 8-month list, and so trying to be able to get the you know, and mostly those are with either medical or especially behavioral concerns and therapies and supports for children like
Got
early
it.
childhood, like that 8 and under especially. So
8 and under medical supports and behavioral supports.
yeah. I was gonna say the medical sometimes isn't quite as bad, but if they're getting into like specialty issues, it can be just as long, if not, or to get services.
What would an example be?
So some of it like is being able to even get access to like hearing tests or being able to get fitted for hearing aids or sometimes even finding dental care that works that accepts Medicaid and work with pediatric patients. And so, I mean, any like just kind of sometimes almost even just general type things that are that a lot of resources don't accept care for. The other thing that, as I said that, the other thing is there are a lot of programs, again, throughout the state, not just in St. Louis, because of the issues with childcare subsidy, that they're having issue, or like a lot of places aren't accepting that anymore. And I feel like when I first started doing this work 25 years ago, a lot of programs had sliding scale fees, but not many places offer even sliding scale fees anymore. So finding affordable care for programs that are for families that can't get subsidy or for programs that aren't willing to accept it to be able to have the support to be able to do things like sliding scale fees.
Yes, fantastic, sadly. And Jamie put in, you know, a little bit of pediatric autism. You know, we know that that is on a rise. And the demand is much greater than the supply. So thank you. Thank you for sharing. I love all the chats. I hope everybody's reading this, and you guys will know that we send this out, we send the recording out, we send out everything in the chat, and we take notes. Housing, diapers, basic need resources for therapy, psychiatric services, psychological services, clothing for foster children, beds for foster children moving into relatives' homes. The richest country in the world. Michelle's like, yeah. Would anybody else like to come off off mute and tell us who you are and your organization and what resources that your families are really needing. Many of you, and you are not shy. Marcia is not shy.
Good afternoon, everyone. And I'm gonna have to get off like at around 1:20 because I have a 1:30 visit. I'm a parent educator with the Riverview Gardens School District. And I typed in the chat about housing. I have a lot of families who are having issues with finding affordable housing for
Mhm.
their families. And then some families are, the rent is increasing. And so they have to move because they can't afford the rent. Another issue is what I think her name is Becky with U4C, um, assistance with children who have autism. Like here in North County, we have a center. They had a small center. Now they're working on a larger center, but there's already a waiting list and it's not even open. So I have a family who really, really needs that. And she lives in North County, but she got accepted in St. Charles. And she's like, I can't drive that far. I need it to be closer to me. So, and as you said, autism is something that is on the rise. So families really need assistance with places for their children to go. And then lastly, foster children. I have a family, a grandma who is fostering her grandchildren, but navigating that system has proven to be traumatic for her because you get a social worker, everybody has their idea of how things should go, and they want to impose that on the family without listening to the family. So that's her issue. She's on her third social worker, and she's only
Oh.
had the kids for a year and a half.
Wow.
Yeah, it's
Wow.
amazing.
I think Denise I don't mean to pull out Denise Carter, but she sent me an email. This was a few weeks ago that St. Louis County had rental assistance for 500 families. And I tried to, and I emailed that out to everyone, but it was, I think it took 5 minutes for all 500
Yes,
slots to be taken.
I got that.
Because
Yes,
because as soon
crazy.
as we clicked on it, it said full, and it was the speed of the internet could not keep up with the need for affordable housing. So what is the name, Marcia, of the autism center that that is being built or is bigger now in North County? Do you know?
It is, I don't know the name of it, but it is at West Florissant. It's where the old Social Security office used to be. At West Florissant and Halls Ferry. So it's before
Okay.
you get to Halls Ferry. And it's the old Social Security office. I believe that's what they're calling it. Just School of Autism, something. I can look it up and see, but I really think
I'm just
that,
curious.
yeah, I really think that that's it. But that housing, that rental assistance, yeah, my families couldn't take advantage of that. It was over. And Section
Yeah.
8 is, nobody can get that either.
No.
Can't get it. The waiting list is so high.
Got a lot of work to do, friends.
Can I speak up for a
Christine?
minute? I'm
Yes,
Christy.
Christine.
I'm with Mercy Kids Autism Center. So,
Oh, great. Great. Thank you.
I actually did put in the chat a couple resources that will provide navigation services to help families navigate, because I mean, we're not naive here. When you get a diagnosis of autism, you also are told to do 10 things yesterday, and they're not 10 things that are easy to put together. So we here only provide that service for people that are diagnosed here, but providers providing autism diagnosis should have some type of services. But if they don't, both Easter Seals and St. Louis ARC can help families navigate all that.
That's great.
So and then in my last comment, I think, I'm assuming you guys are talking about like ABA providers when we're talking about like autism school. I'm just trying to figure out what that was. Because ABA providers are hard to get into too, but I would recommend putting yourself on multiple wait list. And eventually they'll come around. Sorry, I don't have better advice on that one because it is a barrier. But there are more coming on board. So,
Good to hear.
and feel free to ever reach out to me if you have any questions. I don't mind answering questions on this.
That's great. And all of you should have access to the roster. I love that's nice, Jamie, the hearts. Should have a roster of everybody that's a member of this group. And if not, again, I'll share access to our shared Google Drive where you can find anybody and anybody's name. And you can look in the chat. What Christy just did. Anybody else?
Good morning. I'm Mary Crockett Smith with
Hi,
the.
Mary.
Good morning. I'm Mary Crockett Smith with the Christian Academy. Christian Academy 2. I've been in early education for approximately 24 years. I serve as children in the St. Louis City and North County areas. Pretty large centers. We serve about 132 a piece at the end of the day. So coming, going. 6 weeks to school agers. Summer, and in the summertime, only one site does a summer academic program where we work on giving the kids like a pre-diagnostics on math and reading, and then working on specific skills so that they're able to utilize the summer not as a summer learning loss, but as a summer learning gain. And we kind of start where they are academically and then move them forward. Nothing real technical, although I'm a teacher, but it does really put into a child into the upcoming school year a stronger child who's more academically sound and didn't go through the summer learning loss when it comes to math and reading. Okay.
Phenomenal. By the way, Mary, really quickly, Christine Loomis out there with Turn the Page STL, she's going to contact you, Mary. We'd love to learn more about your
Sure.
summer enrichment program. Yeah.
Sure. I've been doing it for years. Awesome. Okay. So I perceive my parents are literally struggling and when it comes to being able to receive childcare, adequately going through the process of getting their paperwork in and then getting approved, etc. I still have children who literally have not been approved since last year, 2024. And I have payments I have not received from 2024. And it's just scary. I believe the cost of living is very shocking to our communities across the board. I don't care what income you are. And then as well, another thing that's truly having an issue on the new upcoming when it comes to having money is this new sick pay leave that every business who makes over $500,000 is going to have to participate in. I think it's going to be an issue. I think we need more support in our communities to make sure everyone, not only early education, when anybody's involved with it, is ushering that in correctly and is doing the right thing and is capable of doing it. I just don't understand how can we afford to do such types of payments getting up to $15 an hour, and we had literally no legislative approval for increasement in pay. The next thing I want to say, another thing that is shocking to our community is that when you do have a high quality performing site or centers, you have staff that are trained and have been with you for years, and they require a lot more financially to stay. And we're not looking at that. You want high quality, but you're not paying for it. And I did say that was the last thing, but one last thing I wanted to add was that the greater the need of the child when they come from at-risk environments and trauma, the greater the need for the resources, the greater the need for the resources to be available. In any school system that basically is running functional and doing a good job practicing good best practices, they have counselors, they have assistants, they have attendants, they have aides, they have secretaries, they have all these different administrative hats that support the best practices wheel. And we do not have those same levels of respect when you go from one age to the other. in our industry. And we really need to consider that in our conversations, because if I'm wearing 15 different hats, the children are not receiving the quality of the best practices that they can receive, regardless to how much you try to do it, even if you work after 9 or 9 to 5. These are things we need to push when we're talking about why our the people who service the children necessarily and the parents need to be supported in these facets that I'm not hearing in our conversations. So, Mary Crockett Smith, good morning.
Mary,
You know.
agree. Thank you. Recorded, noted, and we'll follow through with you on many of these things. You and I sat next to each other at the Gateway Early Childhood Alliance meeting. So to pull them in also into this conversation, because we have to take care of our families here in St. Louis. That's what we're here for. Talking about taking care of our families, Leah, I don't think we need to pull up the next slide, but we have 3 amazing experts here with us today to talk about ParentLink. And I'm excited to introduce Rachel Manning, Angie Nickel, and Kelsey Cunningham. I hope you guys are able to share your PowerPoint about ParentLink, and these are additional resources through the state of Missouri that I hope you will learn about and will be able to share with your families.
Thank you so much, Lisa. Can everyone see my screen?
We see it.
All right, perfect. Well, thank you for letting us be part of this meeting today. It's great to see you all. There are some familiar faces, so it's wonderful to connect with those that we've worked with before and some new faces as well. I will kick us off, and then Rachel and Kelsey will be co-presenting with me. I'm Angie Nickel, as Lisa noted, and I am the Associate Director for Kinship and New Programming at ParentLink. ParentLink is, we are a statewide entity that is housed in the College of Education and Human Development at the university. We have been around since 1989, and while our programming has changed from time to time, based on the needs of the families that we're serving, we have been around for quite some time, and we are for anyone who cares for a child in our state. So just to give a little bit of an overview about our goals and our mission and the work that that we do and what guides us in that work. We believe that all parents and caregivers are meaning and wanting to raise happy, healthy, and thriving children. We also believe in assisting those parents and caregivers in identifying barriers that are making it hard for them to raise happy, healthy, and thriving children. We also believe in positive discipline strategies and in a team approach to wrapping services around families. And that team is within ParentLink, but that also extends beyond our walls to connect with our community partners such as yourselves that, you know, I think we share the same mission and beliefs in serving our families. We also are here for professionals. So while we serve all families in the state of Missouri, we also serve professionals that are in positions to serve families in our state. So we want to make sure that that you as professionals feel supported and have access to the resources that we can offer. Our mission, so the way that we move forward to act on those beliefs, we want to empower parents and caregivers by playing a supportive role in their goals toward raising happy, healthy, and thriving children. So we do that by providing listening and problem-solving support. Sometimes parents just need a listening ear, and we are here to provide that in a very non-judgmental way and in a confidential way as well. We also provide vetted resources and evidence-based information. So we want to make sure that the resources that we are connecting them with, we're not just giving them a phone number, we're giving them a person to connect with, we're giving them information that will guide them on their next step. We assist them in identifying and breaking down the barriers that they've identified in our conversations, and then working with them for as long as they need us to follow up and make sure that they have what they need for themselves and their family, and making those connections with community resources. We support professionals by providing information about state systems, family dynamics, healthy boundaries, and communication strategies. And then also just talking from colleague to colleague through new ideas or approaches to serving families. All right, so our Parent Link services at a glance. All of our services are free. We never charge parents, caregivers, or professionals anything to access our services. In addition to the connections to resources, and again, we make sure that all of those connections are vetted. We also provide assistance to families with social service applications. We'll talk about our navigation, our access navigation services in a little bit, but we have folks that walk through that process with an individual, and they have connection to the DFS portal, so they can follow that application after it's submitted. Kinship caregiver support, that is the program that I oversee. So I'll be providing some information a bit later about what kind of services we have to offer kinship caregivers, or those who are caring for a family member or friend's child. We also offer parenting classes. We do that in a variety of ways. And Kelsey and Rachel will talk about that in a little bit. Child development screenings and referrals. Again, we offer this at no cost. Services for school personnel. This is a new program that we're offering for anyone that works in a school setting that has questions about what to do in the classroom, or how to interact with family members, or just any questions that they have about that. We're here to provide that kind of support, and just brainstorming, thinking out loud, processing things. Services for military families. We have a military navigator that is connecting with our families who are part of the military system, and just making sure that they have connections to the services that are needed for their families. We also provide support for incarcerated parents. And I'll let Kelsey talk about that in a little bit. We have 4 call lines. The warm line is for all parents. I guess I'll get to that in a little bit. We have our Kin for Kid line, our Tellink, and our School Link line. All of these lines are staffed by our professionals Monday through Friday, 8 a.m. to 5 p.m. And while we have different numbers for each of these lines, because we are one unit, one organization, if someone calls the warm line but is really meaning to connect with our kinship program, the warm line can get that individual connected with kinship, and vice versa. So there's really no wrong line to call, because if someone calls one of these lines, we'll make sure that we get you to the right spot. So our warm line is there to provide, again, that problem-solving support. Sometimes you just need someone to think through a problem with you that doesn't have a stake in the game, so to speak. So just bouncing an idea or a situation off of an anonymous person can sometimes be just what you need to take the next step. We provide research-based parenting information with that positive discipline aspect, referrals to services, and early childhood support. Our Kin for Kid line, again, provides that problem-solving support, connection to our family resource centers, connection to tangible, legal, and emotional support. So kinship caregivers, they need practical support, they need legal support, and they need emotional support. So we want to do what we can to provide support in all of those areas. Tellink is our referral to maternal and child health services line. That is not the same kind of conversation. It's more of a referral line. So sometimes Telling will get connected to Warm Line or Kin for Kid Line to do that deeper dive in problem solving. SchoolLink, again, that is our new program connecting our staff to school professionals for that problem solving support and referrals to services. All right, I will toss it to Kelsey.
Thank you so much, Angie. My name is Kelsey Cunningham. I'm a senior coordinator here at ParentLink. I supervise the Warm Line and also work a little bit with SchoolLink. The Warm Line, we really consider it our front door, mostly because it kind of encapsulates all of our different programming. We have been around the longest. Warm Line has operated for, since ParentLink came into existence for over 35 years. So I like to say, just as Angie said, if you call any number here at ParentLink, or if you only remember to call or text our Warm Line, and all that information is on our website, we're going to get you to where you need to go. We're all capable, credentialed professionals who can help support you. We all hold masters in human development, early childhood. Some of us are therapists, social workers. We're available 8 to 5, Monday through Friday. You can reach us in a variety of ways. You can call us, you can email us, you can text us, you can reach us by social media. And we also have translation services. So for example, I had a Spanish speaking caller call in last week, connected them with interpreter services and stayed on the line and made sure that they were supported. Okay, so we provide listening support, vetted resources, and problem solving help. I like to think of it as we are kind of working with callers or emailers or texters on some of that executive functioning pieces, like figuring out where do I go from here? What are my next steps? We answer calls every single day, anywhere from 5 to 15 contacts a day. The best part about our jobs is that every single day looks different, and we'll kind of talk about what some of those calls look like, but it's exciting because we're really meeting parents and caregivers where they are, answering general parenting questions, helping with additional child development activities and supports, linking with community resources, and really figuring out how we can help parents and caregivers kind of get to that next place where they're implementing positive discipline strategies and raising happy, healthy kids. In addition to that, we also, our Warm Line supports, we also have a blog. We're kind of on hiatus now. I like to call it our podcast, but it's really a Zoom recording. We kind of had to stop for a minute, but I am happy to say we are back in production with Let's Talk About It on kind of more formal basis. That's where every week we talk about calls that we receive. We're not giving out names or any identifying information, but we're really letting everyone know statewide, here are the types of things that we hear on the Warm Line, and here's what you can call in about. We also offer individualized Zoom parenting sessions. Some of these can be court approved. We have a curriculum of 5 different classes, which take 5 weeks. We don't offer certificates at this time, but we work closely with caseworkers to make sure that, those needs are being met. We're also happy to work with any parent who has a very specialized concern about biting or toilet training, or, even how to co-parent, how to have those tough parenting conversations. In addition, we also offer parenting discussion groups out in the community. I'm hosting one tomorrow at our Boys and Girls Club about technology and, easy tips and tricks. How can we figure out boundaries about screens and tech, and how do we talk to our kids about it in a really easy to digest way? All right. Rachel, you want to talk about our early childhood support, please?
Yeah.
Yeah, so part of what I do is I work on the warm line, but I also help by providing this early childhood support. This is where we have ASQ developmental screenings. We do the ASQ3 and the ASQ SE, which is the social emotional screening. And then we provide those, and after parents complete them, we're able to go alongside them and work with them on any like concerns they might have by providing that evidence-based information and developmentally appropriate activities. And sometimes this might include hopping on Zoom with them and chatting with them about what's going on and what they are needing. This also might look like getting referred to somewhere where you can get an autism diagnosis, and that will what we do is we'll call around places and try to find wait times, who to call, who to talk to, and then we pass that information on to the parent. And sometimes we also do a warm handoff where we will call with them and we can't set the appointment up for them, but like we can try to get them connected that way. This also might look like getting connected to community resources, therapy resources. And I also, we've partnered with our local diaper bank in Columbia and doing like different diaper drives and outreach that way to get more developmental screenings. And when parents complete the screenings, we also can send an early childhood bag. And this includes diapers, wipes, a book, a toy, and some other like developmental information and activities. But yeah, it's just a way that we can work alongside them if they're having any concerns about their child's milestones. Even if they're not, we'll still talk to them about any behavior issues that go along with that as well.
All right. So what are people calling in about? People ask me all the time, other professionals, okay, Kelsey, are people really calling this call line? Absolutely, they are. I believe that last year in 2024, we reached over 8,000 people, which we're really proud of. We reached 104 counties statewide. All of our support is free. The biggest piece that people are calling in about is what we call our family functioning piece. This includes information on co-parenting, child abuse and neglect questions, child custody questions, legal supports. We are not in our role case managers and we can't give legal advice, but I can help you, navigate that social institution. We can talk about next steps. We can talk about words to use. Another big part of what we do, parenting support, parenting classes, parent self-care, linking people with support groups. Those are, everything that we do is how can we support our parents so that they can focus on their kiddos. Child development issues, everything related to the ASQ. I saw in the chat, thank you, that's such a nice comment. We really do work hard to provide those wraparound supports and links to experts. Basic family needs, this includes transportation, clothing needs, help paying utility bills. We all know right now that transportation and housing, they're so tough right now, but we really do our best to help find good community resources. Caregiver communication, lots of mediation questions, lots of co-parenting questions, and also how do I work with the other people in my life, my child's teacher, my child's daycare provider, to make sure that we're all on the same page. Behavior issues and the developmental screenings we do. So those are everything that we do here on the Warm Line. So it is always busy and always fun. And I'll quickly mention before I pass it off to Angie, these are our parenting class flyers. We do offer parenting classes. For our court approved classes, we offer 5: understanding positive discipline, the importance of connection, communicating with your child, empathy and self-regulation, and understanding trauma. All of this information is evidence-based, no opinions here. They're all about 1 hour long, and we work really hard to schedule with parents when it's convenient for them. And then I'm going to let Angie talk about our Parenting Foundations course, which we're working on, and we're so excited that's coming this summer.
Absolutely. Thank you, Kelsey. Yes, we have been partnering with faculty in human development and family science at the university to develop parenting foundations. It's a free online self-paced learning course for parents and caregivers with children aged birth to 5. And our spin on it is, again, it's for anyone in a parenting role that is having some questions or concerns about their role as a parent. Some of these individuals may have a children's division caseworker, or they may have been required through the court system to take a parenting class. And so this would be an opportunity for them to meet that requirement and build their parenting skills in a free and self-paced way. We will also connect individuals who are going through this online course with our family support services. And so an individual or individuals within ParentLink will be working alongside that person as they're completing this course. So they have that human connection where they can ask their specific parenting questions, talk about their family dynamics or whatever they need to just process alongside someone else to get them into perhaps a better place in their parenting role. So we're hoping that this is an effective way for families to stay united or become reunited if the children have entered into the foster care system. So that is a group. Another group is anyone else in the parenting role who just wants some information about child development, communication in the family and with your children, understanding trauma and the impact that has on early development. So all of those things will be covered in this online course. Okay, so Access Navigation, I mentioned that earlier. We have Access Navigators who are credentialed community health workers, and they work with families to navigate barriers and also get them connected to social service support, such as Medicaid, TANF, TA, SNAP, food support, or child care assistance applications. So again, they have access to the portal, the state portal, and they can not only help the individual go through the process of applying, but then also help them follow that application and just be that liaison between the state agency and the person applying for that assistance to just help the individual feel like I have someone, like a person that I can connect with along this journey. And so they can connect with an Access Navigator by calling either the Warm line or the Kin for Kid line. But again, if they reach out to any of those lines, we can get them connected to the right place. Our Missouri Kinship Navigator program, we are excited to be launching our Kin for Kid program. It is led by the Missouri Department of Social Services Children's Division and made up of 5 organizations. In the St. Louis area, we are working closely with Family Forward and Foster and Adoptive Care Coalition. And we have other family resource centers throughout the state that we're connecting to create Kin for Kid. And we are really hoping to be able to serve in any capacity anyone who is finding themselves in a position to raise a family member or friend's child. Usually this is a situation that is created from a traumatic event that has occurred. And so this is typically not a planned placement. It happens relatively quickly, and it can either be formal, where the state has taken custody of the child and has identified a relative or a known person in that child's life to care for the child temporarily, or it could be an informal placement that happens completely outside of the child welfare system and is just a voluntary agreement, let's say, between the parents and the caregiver. So going back to what I had mentioned before, we know that kinship caregivers need legal support. They need connections to education and emotional support, and then also connections to practical support. So we are developing this program to make sure that we can provide support in each of those areas. For our legal support, we are connecting with the Child and Family Justice Clinic at MU to offer free informational legal sections. These are Zoom sessions where the caregivers can ask lawyers any questions they have about their case in a confidential and just personalized environment. We also have, I'll put our new MOCN for a Kid website in the chat here in a minute, but we also offer an online legal toolkit that's made up of videos and fact sheets that provide non-jargony kind of information about these are some options that you have available as a kinship caregiver when you have a child in your home and you don't yet have the legal status you need to properly care for that child. We have connections to free legal services in 5 counties right now. We're hoping to grow that in more areas across the state as we get funding to do that. And we have connections to free or low-cost family mediation services across the state. For educational and emotional support, we offer 2 virtual empowerment groups each month. The first is informational, and that is there's conversation and connection between caregivers and ParentLink kinship resource specialists, but we do have a topic that the kinship resource specialist will present that is relevant to a kinship caregiving sort of need or identified area. And then we have a group that is just peer. It is just peer led. We do have our kinship now resource specialists facilitating those conversations, but peers come together and they talk about whatever is on their mind. And then we have in-person events throughout the state. We have caregiver cafes, support groups, and some fun family events that our resource centers provide. Connections to resources and practical support. We offer a variety of ways to get them connected to community resources through ParentLink and also through our family resource centers. And again, anyone who calls into the Kin for Kid line can also access other ParentLink program offerings such as parenting classes, navigation services, early childhood screenings. And then we have some tangible goods that we're able to offer caregivers who need it. All right, that was a lot in a short amount of time, but we definitely want to be respectful of your meeting time. And so please feel free to reach out to us at any time if you have questions or would like to talk through anything or would like us to send you some materials, some informational materials about our programming that you can hand out to families that you work with. We're happy to mail you a bunch of goodies. So just let us know how we can support you.
And Angie, I just put that in the chat. I just put our materials request form in the chat.
Perfect. Thank you. And I will put our MOCN for Kid website in the chat as well.
Phenomenal.
Oh, thank you. Lisa, would you like, I can answer a couple of these questions that are
Yes,
in the chat really quickly.
One of them was, yes, please do.
Yeah, so of the 8,000 warm line calls last year, I would be happy to run that report based on counties, but I can tell you probably a third of the calls that we receive are from the St. Louis area.
Fantastic. Thank you.
High amount. And yeah. And can I elaborate more on the transportation services?
Yes.
I can sure try. I'm just laughing because I wish, you know, we're all in the same boat, and I wish that I had a perfect answer, and I wish that we had supports for all the families who need transportation services. It is really, and I have a fly who's my friend today. It is really a case-by-case basis based on county. A lot of the transportation services and supports that we're finding are specific to that county, like local churches who have a group who offer, you know, rides to the dentist or rides to our elderly friends in the community. So it's transportation, bed bugs, housing, those are tricky. and we do our best. Most of the transportation calls we receive are, I need a ride to my doctor's appointment. So usually we can help figure those out.
That's great. Well, Leah, do you want to bring up our final few slides for the St. Louis Region Community Leaders Parent League? Thank you. Thank you. All we can say is keep doing it. Keep doing it, keep doing it, keep doing it. I want Leah to jump ahead to the slide about the upcoming St. Louis Childhood Transition, just due to time. There we go. And I'll let you.
I'm leaving you all. I'll just say it. I'll be straightforward. So the Community Innovation Action Center will be transitioning out of our role as community leader after this contract period with United for Children, which ends at the end of next month. So next month will be my last meeting here with you all. I'll probably pop in from time to time. I'll say that it has been such a fun adventure to be a part of this work. We initially came into this when our center was doing more statewide early childhood work. And as I mentioned at the beginning of the call, like some of our work has just shifted and we don't currently have any projects in the early childhood ecosystem. So I would love to be able to take a step back so that I can offer someone else who works deeply in this ecosystem an opportunity to step forward into a role of community leader. So if there is anyone here on this call today or anyone that you know of in the early childhood ecosystem in the St. Louis region that you think might have an interest in supporting this work in partnership with Lisa and Tiffany moving forward, please, please, please consider it. I know Lisa, Tiffany, and I are happy to chat with anyone who has questions about what this role looks like, what the expectations are, how much time it takes, how much money is available to help support the work. So yeah, if you're thinking about that, please let us know.
And you have to work with me.
You have to work with Lisa. I can vouch for how much fun that. But yeah, that's just wanted to share that update with the group here.
Thank you.
Yeah.
Thank you, Leah. Next month, we'll be talking about some changes happening statewide for the community leaders work out of the Office of Childhood. Just a reminder, please make sure your services are listed in the Missouri Family Resource database through the Office of Childhood. And next slide. You guys all know that the childhood community leader work, it's divided into 7 different regions, and St. Louis is one of the 7, and we have the least number of completed surveys. So I get really competitive, and this is the time where you can talk about the work that we're doing here in St. Louis and bridging, creating that bridge to the Office of Childhood and to state resources and local resources back to you who are part of the community. So please, and I will, when I send out all the information from this meeting, I will include that survey again. It really takes less than 5 minutes and it's extraordinarily valuable information for us. It's a time for you to really tell us your needs, and for not just for Leah and I to see it, but then for the Office of Childhood to also see needs. And I think just a couple more things.
Yeah, this was a save the date for the St. Louis Regional Suicide Prevention Coalition. They have a speaker series that's coming up next month. It is virtual, and that QR code is probably not going to work so well on the screen, but I think in our notes we have the link. If you have an interest in signing up for that, we'll make sure you get the link for that.
And it's posted on our Facebook page.
Yep. And I'm going to skip past that and just give a quick quick update next month. We'll be back in the same Zoom room on May 21st at 12:30. Peggy Neufeld from St. Louis Be Smart is going to come and talk about Everytown for gun safety and what that program is doing. And then Shauna Kerprin from Blair Oak School District is going to come and join to talk a little bit about some transitions that are happening with the community leader work at the state level. And then Lisa is going to talk about fun literacy-rich summer activities that are coming up in St. Louis. So we hope that you will join us again in this Zoom room next month. Invite others that you'd like to have come to this space. And we are almost at our time. I think these meetings, we need more time because we always have so much good stuff to talk about. But I'm going to stop sharing my screen so we can see everyone and ask if folks have any questions, any outstanding things you want to discuss in our last 10 seconds.
And know that you can always reach out to Leah and to me and to Tiffany, and we'll do our best to find the answers. All right. Guys, have a wonderful, wonderful rest of your day. I hope you can get outside and just take a little walk, and appreciate good weather in St. Louis. And thank you all for attending.
Have a great day, everyone. Bye-bye.